And it's Suicide Prevention Awareness Month, but for people in minority communities, getting help can sometimes be difficult. We hear from a local organization working to break down barriers.
September is Suicide Prevention Awareness Month. For many people in communities of color, the process of navigating treatment can be quite difficult. Mary Jane Belliazza joins us in studio now to explain. Mary Jane?
Local organizations want to bridge that gap and break barriers to minority mental health care, but they say it's going to take the community's help. Racial and ethnic minority communities still face unique struggles when it comes to mental health. Dr. Sid Khurana from Nevada Mental Health knows the struggles minorities face all too well.
Asian culture, the culture I come from, we are 1/3 less likely to seek mental health care than the Caucasian counterparts. And that comes from our own perceptions of mental illness, lack of adequate insight.
In many cultures, the negative stigma about mental health comes from fear or shame, preventing people from seeking help.
They do not believe that they will get the right care from their treatment providers, that their culture would be understood, their language would be understood. They have a distrust of the system, and that many times are factors keeping them from seeking care.
Other factors also include the type of community you live in, lack of transportation, and lack of health insurance. Dr. Sheldon Jacobs, the vice president of NAMI, the National Alliance of Mental Illness in Southern Nevada, is trying to change that.
We've been working a little bit more with youth as well as communities of color. And so really one of the emphasis has been on just meeting people where they are.
Dr. Jacobs says NAMI is working on partnering with other local mental health organizations to identify those needs.
So we're really trying to educate individuals in various communities about mental health, and then also just trying to normalize as much as possible by spreading awareness.
NAMI has a number of services like peer-led support groups and mental health events free of charge.